purpose of today's webinar is to create an opportunity to explore new data features and discuss opportunities to use the rankings as a communications tool. We really hope that today will help prepare you for the release. And the release this year is scheduled for March 18th. As we begin, we like to acknowledge that County Health Rankings and Roadmaps is based at the University of Wisconsin Population Health Institute and is a collaboration with the Robert Wood Johnson Foundation. We also want to acknowledge that this program is the result of the contributions of many colleagues and partners in Wisconsin and across the nation. So today I'm joined by members of our team from all across the country, and we're here to make sure that you have the information you need to be ready for the March 18th release. So just going to take a minute to welcome my colleagues here into the virtual space. So let me start. Courtney, welcome.
Hi, Allie. Hi, everyone. Thanks for having us.
Yeah. And next we'll go over to Raquel.
Hi, everyone.
And Keith is with us. He's also with Courtney, so we'll say hello to Keith, but his voice won't be brought into the room. Annie, I'll go to you next.
Hi, everyone.
And James is here today helping us all with our technology, like he helped me when I was on mute at the start of the webinar.
It happens to the best of us. Hi, everybody. Welcome to the webinar.
All right. So wanted to do a quick walkthrough of what we're hoping that you get out of today's webinar. So we're going to share some new features and resources in the 2020 County Health Rankings, and really Annie's going to walk us through that. Then we're going to provide some tips for using the featured tools and resources. And towards the end, we'll discuss strategies for how to leverage the rankings release to inspire action in your community. We've got a couple of places along the way to lift up questions. So just as a reminder, please use the Q&A box to drop those questions in, and we'll certainly circle back to them throughout the webinar. We also wanted to let you know that directly following today's webinar from 4 to 5 Eastern, we're going to offer an extended Q&A session. Last year, we had a lot of questions come in and the conversation continued, and so building on what we learned, we're excited to offer this extra time and space to answer questions. So later on, look for a link that we'll share in the chat box. Raquel will share that, and please join us for that extended Q&A. All right, so let's dig in. I'm going to offer a little bit of framing, and then we'll turn it over to Annie to hear more. And so looking at this image on the screen, when we talk about our data resources, the first thing that usually comes to mind for people are the rankings. And these are one of our primary data tools. We are, after all, the County Health Rankings and Roadmaps. So this picture shows the thinking behind the rankings, about how the rankings can be a catalyst for action that improves the health of everyone in a community. So I'm going to just take a minute and walk through this image. And so if I could guide you to the left-hand side where it says population-based data, that is our starting point, and we use population-based data from a variety of sources. Then we use that data to rank the health of nearly every county in every state. And then the ranks are great for garnering attention, and each year the rankings report release generates national, regional, and local media. It's an opportunity for people to tell the story of the many factors affecting health in their community and what is going well and where there might be opportunity to make things better. Then you can use this information as an opportunity to mobilize multiple sectors to look further at your community's strengths, opportunities, and needs. Based on this deeper look and unique properties, community members can identify evidence-informed strategies to be implemented locally to make change. Over time, these strategies ultimately result in longer, higher quality of lives for everyone in the community. So really think about the ways in which the county health rankings are essentially a call to action, right? So it's not just about numbers, it's about how the rankings can be used as a call to action. You can use the rankings release and the attention that comes with it as a way to either start or continue a conversation about health. In a little bit, I'll talk about how you can use it as a call to action. But first, we want to hear how you've used the rankings in the past. So I'm going to encourage you to use the chat box, and we'll check back in a little bit, but share with us your experiences using the rankings as a call to action. And before we leave this image, and as we turn it over to Annie here in a couple of slides, we're really going to focus on the horizontal portion of this image, and we'll start by talking about the data. And so as we start with the data, we think about it as a resource that can be used throughout the community health improvement process. A couple of the ways in which it can be used is to help us uncover health issues in our community. It can help us discover where and with whom these issues are located, and then it can help us get to the root cause of the issue. And so the rankings are one tool to help your community with all of these steps. And so with that, I'm going to stop my share, and I think Annie's going to start sharing. And while we're doing that, I'm wondering, Raquel, it looks like some folks are chatting in how they've used the rankings as a call for action. Is there anything that you'd want to lift up?
Let's see here. Gosh, we've used the rankings to prioritize counties to disseminate the community input surveys in their SHIP process. Folks have used the information for submitting grants and presenting to county commissioners and to local coalitions. So some great stuff.
Great, thanks, Raquel. And Annie, we'll turn it over to you.
Thanks, Allie. So today, as Allie said, I'm going to help you maximize your use of the rankings data for 2020. And first, I'm going to talk briefly about what goes into the rankings, and then I'll talk about what's new this year, including an overview of the themes from our key findings and state reports, as well as our 5 new additional or unranked measures. And then I'll introduce those measures and talk about a new website feature we're all very excited about, as well as a new app that allows for really neat data visualizations. Finally, we'll take a quick tour of the current website to visit some don't miss tools. So let's start with the model that underlies the work of the rankings. One of the goals we've had with this image is to help change the conversation about health and what influences health. What this image shows us is that health is more than what happens at the doctor's office. A wide range of factors influence how long and how well we live, and it includes things we often think about when we hear the word health, like healthcare and how well we eat or how much we move, but we also know it's things like education and income, the quality of our housing, and the safety of our neighborhoods that have the greatest impact on health. So starting from the bottom of our model, we know from research that effective local, state, and federal policies and programs can improve a variety of factors that in turn shape the health of communities. Many health factors, the blue boxes, shape our community's health outcomes. We specifically look at and measure health behaviors, clinical care, social and economic factors, and the physical environment. And we measure 2 types of health outcomes, those green boxes there, to show how healthy each county is. And here we measure the length and quality of life. So how does that model translate into measuring health in counties? Well, we have 35 ranked measures this year, and these are all identical to last year, if you looked at your rankings last year. And Raquel is now going to chat out a link to a PDF of this year's ranked measures with their data sources and the years of data we're able to access. And so please feel free to open the file if you're interested. And our measures are selected using a variety of criteria. Measures must meet a variety of technical and feasibility criteria, as well as be appropriate for our program's goals and meet community needs. Technically, measures need to have a strong link to health, be available at the county level for nearly all counties in the nation, and have a relatively short time lag, as well as be updated frequently. And to meet our goals and community needs, measures must reflect a modifiable aspect of community health. They must be easy to communicate, and we're of the mindset that fewer measures are better than more. So any new measure, particularly any ranked measure, must bring added value to the model without diluting it. And if you open the list of measures, you would have seen that there are almost as many data sources listed as there are measures. So this is the list of the more than 20 data sources that we use. And we really want to acknowledge that this work cannot be done without the many state and national organizations that calculate and compile comparable local data for counties throughout the US. I want to take a second to give particular thanks to the Behavioral Risk Factor Surveillance System and the National Center for Health Statistics at CDC for the data they provide to us. So that was a pretty quick high-level summary of the measures and methods that we use to construct the rankings. But in order to give us more time to help you get the most out of the webinar, we're going to skip a more in-depth look at our methods. But if you're new to us, or if you'd like a deeper look at the rankings and how we actually calculate them, so measure weights, z-scores, and the ranks themselves, please take a second to watch this 20-minute webinar that we've recorded. It's on our website, and there'll be a link to this webinar included in the PDF of resources at the end of the webinar today that'll come in your email. In addition, on April 7th, we'll be having a County Health Rankings and Roadmaps 101 webinar, which will cover more about why and how we rank, as well as highlight other areas of our program. So if you're new to us, that's a good date to put on your calendar to see not just the rankings, but also the roadmaps and other areas that we offer. So what's new this year? What are we adding for the 2020 release? Well, it's our 10th anniversary, and we're really excited about the addition of some new additional measures and tools to help you translate those measures. This year, the Key Findings Report really highlights the magnitude of the work that the program has focused on over the last decade. It highlights both good and bad trends in health and takes an in-depth look at some key indicators such as life expectancy in children in poverty. Measuring the rate of children living in poverty assesses both current and future health risks of a community. Children are particularly vulnerable to the adverse effects of a lack of family income that keep families from meeting basic needs like secure housing, food, or medical care. We also continue our interest in social and economic factors and health equity research. In doing this, we highlight wins in poorer ranking counties and continued disparities in higher ranking counties, as well as all counties throughout the US. The state reports continue these themes of ensuring not only health, but also health equity issues are at the forefront of our work. The goals of our state report are to discuss differences in health outcomes and health factors by counties within states, differences in health factors among racial and ethnic groups, and county health rankings and roadmaps resources that can help you take action to improve health. So in this report, you'll find a series of graphics that show health outcome and health factor ranks. Here we see health outcomes in California, where I'm coming to you today from. And the maps are likely familiar to you, as we've used them for many years, and they show the distribution of health outcome ranks broken into quartiles. The dot plot to the right shows the distribution of underlying z-scores that contribute to the health outcome ranks. The graphic shows that the difference between the ranks of 1 and 2 is not always the same as between 3 and 4 or 57 and 58. So this type of graphic can help you identify clusters of counties that are similar and begin to determine meaningful differences between counties. The key here is to reduce the gaps between the counties to reduce geographic disparities. Here's the same graphic for health factors in Maryland, where Allie lives. And you can see there are 2 clusters of counties around the 1st and 3rd quartiles. But there are also 2 counties that rank much better than the rest, and some counties at the end that are struggling. So each state will have its own pattern here, and it'll be important to understand what's occurring in your state to understand the graphic. Again, it's important to think about the gaps between the counties and the reasons for these gaps. So the state report also includes this graphic for children in poverty. And children in poverty has been one of our key indicators of health at the county health ranking since our existence. And this graphic is new this year and has a lot of information, so bear with me a second as I help you digest it. First, the circles indicate counties. So the gray circles indicate all counties in the US, while the orange circles indicate the counties within your state and the county values for children in poverty. You can see the axis for the entire graphic goes from 0% of children living in poverty to 100%. And I should say this is, again, for Maryland, where Allie is from, just so you know what you're looking at. And so the first line up on top there that says all children shows the values for all children in your state at the county level in the circles. And then we have the state value in that black triangle pointing downward and the national value in the gray triangle pointing upward, which give you some context as to how your state is doing. Below that, you see data broken out by race with counties along with race data at the state level in the yellow triangles. You can start to disentangle some racial and ethnic disparities this way. In addition, you can always visit the children in poverty measure for your state to start to explore which counties correspond to which data points on the graphic. The main purpose of this graphic is to illustrate the size of the gaps that exist from one county to the next, and the patterns we see when you dig deeper to look at differences among racial and ethnic groups within counties. Communities can use this interactive to ask some basic questions, such as how does your state compare to the nation? How big is the range overall among counties in your state? How do those patterns differ by race or ethnicity in your state or the US? And how does the pattern in the US counties differ from the patterns in your state? You can see in this example that there's a wide spread in rates of children in poverty, and that poverty rates for children of color are often higher than the state or national rates. The pattern in these data should encourage us all to ask why and to take a closer look at community conditions where we live, including past and present policies and systems in our community that may be limiting opportunities for all families and children to thrive. So you'll notice similar unfortunate patterns as you look to multiple states with this graphic. And unfortunately, these graphics show that the opportunity to be healthy differs both by place and race, and that this difference starts among youth. So obviously in the state report, this image is a static image, but we have a really talented analyst here who has been working hard to bring this data into an online app. So this year on release, as Ali said, March 18th, you'll be able to play with the graphics for 4 different measures and turn on and off those state and national features that I mentioned before. So the measures that you'll be able to see on the app are life expectancy, low birth weight, children in poverty, and median household income. And this way you'll be you can easily scroll through all 50 states for a single measure, or you can look at the 4 key indicators for your state, for counties or state values in your state. And if we have time, we can view some of these in the discussion group that Raquel and Ali mentioned before. Raquel chatted out. And so we really encourage you to look at this data when it comes live and think about counties and population groups in your state, as well as to consider the local histories and lived experiences as you choose to move to action. So I just walked through a ton of information on the state and key findings reports. So I just want to give a quick reminder to please chat in things you're excited about for this year, as well as a reminder to use the question and answer box for our team to answer any questions you have. Courtney and Keith, who you saw at the beginning, are live answering questions, so feel free to chat in your data questions to them, or other questions for other team members too. So we've also added several new additional measures this year, as we do in previous years. And we've added new measures as we find available data sources, as well as to stay on top of relevant health issues and bring equity to the forefront. Our 5 new measures this year are suicides, reading scores, math scores, juvenile arrests, and traffic volume. So suicides has been added, again, as an additional measure. It's always been captured in our injury death measure, where we injury deaths measures intentional and unintentional injuries. But now it's subset by itself as an additional measure. And suicides includes the rate of intentional deaths per 100,000 population. And for this measure, we provide an age-adjusted and crude rate in order to allow you to better compare it with other measures in the county health rankings. We also have 3 new measures surrounding youth. Data on 3rd grade reading and math scores comes from the Stanford Education Data Archive. And these measures capture performance of students on standardized tests and are comparable across the nation. The measure captures the average grade level performance for 3rd graders. So a value of 4 indicates that 3rd graders in your county are testing 1 grade level above expected. The other youth measure is juvenile arrests. And this measure aims to bring a conversation around supporting youth into adulthood, particularly for young people who have encounters with law enforcement. It only tells one part of the story from arrest to delinquency, as it measures the number of petitioned and non-petitioned court cases in a county. But we hope that it invites a conversation around policies in your community to support youth. The last new measure lives in our housing and transit category and is traffic volume. This measure was generated by one of our research grantees a few years back, and we're really excited to introduce it nationally this year. The measure can help inform conversations around air quality, noise pollution, and alternate forms of transportation. It captures the density of traffic in a county by averaging the distance and density of traffic volume from census block centroids and weighting that up to the county level. So all those measures, again, are coming live March 18th with release. And we also have 6 additional measures with race data available. Most of these are related to injury deaths and their subcategories. In addition, the reading and math scores will have race data available as well. New for 2020, we've also added confidence intervals around the race data for most measures, which allow you to compare for meaningful differences within a county by race. And finally, we've added the data available for more racial and ethnic groups. Asian, as well as American Indian and Alaska Native, have been added to all our measures where the data is available. So here's a quick snapshot of what that'll look like. You'll now see the 5 races, and this is still a work in progress, but the 5 races with the data points as well as the error margin for those values. In addition to our new measures, we have been hard at work on website enhancements that we hope users will really enjoy. One we hope you will explore is an improvement that brings our maps front and center. On your state page, you can now overlay city as well as congressional district data. So you'll see the city and congressional districts options to turn those on in the bottom left corner there. And you'll see I have the city data turned on, and now I'll select congressional district data. And this can be an informative way to look at your data. When you select a congressional district data, or a specific congressional district, it'll pull up the county health rankings that pertain to the counties that lie within that congressional district. And this can be helpful to identify additional geographic disparities as well as inform how policy impacts health outcomes. I want to note that this isn't congressional district health data, it's just the county health data, and another way to look at it using maps and overlaying those features. So now I'm going to move on to a demonstration of how to maximize your ranking snapshot. As we've worked with counties throughout the years, we found that many have not taken advantage of the various tools and resources we've added to our website. So I'm going to do a quick walkthrough of the website. So let me share my screen. Pause with me a second.
Yeah, Annie, and while you're switching over, just wanted to lift up that the chat has been super active and lots of great shares about excitement for the new additional measures and thinking through some of the ways that folks are excited to use this year's rankings release. So thanks for sharing, everybody. Really appreciate that.
Thanks, Allie. That's great to hear. And thank you for everyone sharing those. I'm excited to go back and read them all. As you can tell, we're excited about all the new features this year as well. So I'm at the homepage for countyhealthrankings.org. Actually, I'm in Explore Health Rankings, but I'm going to go to Placer County. That's where I'm coming to you from today. This is a county health ranking snapshot for Placer County. This is where the bread and butter of what we do at County Health Rankings in terms of data at the county level. So you'll see on the left all the ranked measures that we have, and then on the right, the ranks for your particular county. I want to highlight that underneath the plus signs here are all the additional data that's sort of hidden, but you can open it up. So those new measures that I mentioned will be coming under the additional measures for social and economic factors, as well as housing and transit. And then right here under premature death, the first little eye icon actually has some really valuable information that often gets overlooked. So we have the leading causes of death under age 75 for your county. Hidden here, we put the number of deaths as well as the age-adjusted rate per 100,000. And it's under 75 to match the premature death measure as well. But this can be really useful for priority setting and to determine what is leading to the premature death value in your county. The next column has the trend graphs, and you'll notice that the icons are colored green, yellow, and red for if they're improving, staying the same, or worsening. But you can actually open up these icons, and then you can look at the trend for your county over time compared to the state, as well as the nation. And all the data points for those trends are at the bottom of the trend graph, so that's a really easy way to get that data if you're trying to measure progress over time instead of scrolling back through 10 years of snapshots, for example. The other things I want to highlight here are areas to explore and areas of strength on the top of the snapshot. Our team does some mathematical modeling here to give some, to compare your county to states within the nation and within your state, as well as over time. And so we've highlighted some areas that you might want to look at. We call them areas to explore, or might be areas of strength. This is really intended to be a conversation starter. We're not trying to say this should be your priority area, but it's really just intended to be another look at some things you might consider where you're doing well or where you might improve. You can also translate your snapshot into Spanish, which can be really helpful for community. And then lastly, I just want to highlight the Compare Counties feature, which often gets missed. So it's on the tab at the top there. Because I came to you from Placer County Snapshot, that one's already selected, that county is already selected. And you'll see all the ranked measure data along the right here, as well as for the state that the county is in. And then there's additional, you could also select additional measures if you wanted to compare those. You can actually compare side by side any county in the US. We give a little indication if a measure shouldn't be compared state to state. For example, high school graduation isn't always one-to-one. Or you can select from a list of peer counties. So I'll select from El Dorado County, which is just down the road here. And now I can see all the data side by side for those two counties. You can actually select multiple counties here if you'd like, or multiple, you can select up to 10 or I think 12. So you can actually do a lot side by side instead of printing off two snapshots and having to visually compare them. That can be really helpful. So I'm going to transition back to my slides. And Ellie, did you want to share anything exciting that's coming in from the chat while I do that?
Well, and Annie, as you're doing that, so there was a question to explain what we mean with the top performer column, and a lot of folks shared early on that that was super useful. So I'm wondering if you might just elaborate on that for a second as you're transitioning.
Yeah, so that's a good question. So the top performer category is, I like to call, so it's the top 10% of counties in the nation. That's the value that's represented there for that particular measure. And so when I talk to communities, I often think about, it's what we would think about when you want to get an A on a class project, right? That's the value that you're striving for. So it's really that top 10% of counties in the US. So it's another comparison benchmark, rather than comparing to your state or to the US value, gives another benchmark to strive towards.
Great, thanks, Annie.
Thanks, Allie. And I'll keep going through this, but these were just what I shared. And so if there's things that are exciting or you hadn't learned about, feel free to share those in the chat or haven't used on our snapshot. We'd love to hear that if there's things you're going to use this year that you haven't used in the past. And actually, I'll pause a couple questions for a couple questions from the chat. So Raquel, do we have any questions coming in? Any additional questions coming in?
Sure, we do. Let's see. So how have measures changed over time? Can they be compared to previous years?
Oh, thanks, Raquel. That's a really good question. So I think that's a twofold answer. So our trend graphs are one helpful way to do that. But yes, our measures, we try to keep them as comparable over time as possible. And actually, I'll lean on Courtney, who I know is doing question and answer boxes, but I'll ask if she can share the link from the website. We actually have a resource online that looks at all our data back through 2010 and shows exactly which measures are available or could be compared over time and where those trend breaks happen. For example, the behavioral risk factor surveillance system, we used to use 7 years of data, now we use 1 year of model data. So there's a little concern with certain years comparing. So thank you, Courtney, for chatting that out to everyone. But yeah, we have that on the website. This document she'll share is obviously only through 2019, but the 2021 will be available come release day.
All right. Do we have time for one more, or should we keep going?
Sure, let's do one more quick.
Okay. Why third grade for the reading and math scores?
Oh, thanks, Raquel. That's a good question. So CETA, as I mentioned, is our data source for that. And they actually, and we link to them in our Digging Deeper section, they actually have 3rd through 8th grade reading and math scores available. And so we chose 3rd grade for 2 reasons. One, because we're interested in outcomes at younger ages in terms of health interventions for long-term health. Currently, we only have high school graduation, which is a pretty long-term outcome of education. So we really wanted to focus on kind of a youth measure there or younger ages. And then also it's just a coverage issue. When we looked at the data points, that was the place we could get the best coverage across states and counties as well. So that's why 3rd grade reading. But if you're particularly interested in 4th grade for your state, we send you right to their data resource, and you could get that as well. So thank you, Raquel. So I'll keep going now, and we'll have more time for questions at the end as well. So there's 2 other places on the website where we made some significant enhancements for release. And actually, these first 2 What Works for Health updates that I'm going to talk about are currently live on the website. So we hope you take a look at them. So What Works for Health is our menu of evidence-rated strategies. And there's over 400 strategies that our evidence analysts have rated and reviewed for you. So it could be kind of hefty to sort through. And so actually, based on user feedback, we've created this enhancement of being able to filter strategies. So you can see I've chosen community safety as my topic or health factor area that I'm interested in working. And now I see only 57 instead of the 400 plus strategies. And I could further refine that search by different approaches, decision makers, or evidence of effectiveness ratings. You'll also see on this page that now with the strategy, we also have the evidence rating front and center, as well as the different health factor areas that strategy belongs to, because we know health improvement often spans multiple health factor areas. So one strategy isn't always limited to one health factor area. So we've tried to make that more transparent. The other update that's already live on the website is the printing feature. And so if you go to any strategy and then click on print this strategy, you're now going to get a really nice 1 to 2 page document that summarizes everything that's online. And we're really excited about this because you can now take this as a handout for presentations or community meetings, places where you wouldn't have access to What Works for Health online, and now it prints in a really nice, succinct, clean way. So we're really excited about that enhancement. Again, these are max 2 pages, so they're a front and back printout. So we're really hopeful that you guys will use those in community and throughout health improvement. The other strategy, or the other enhancement, I should say, that's coming to the strategy page that will come live with release is the ability to save strategies. We're really excited about this. Again, based on user feedback, we've created this enhancement. So now where the print this strategy is, you'll also see save this strategy, and you can click on that star. And you'll see in this example, I've saved 5 strategies. And if I go to my save strategies, they'll all appear. So you might come in thinking, I want to work on, I don't know, child obesity rates, and there's 20 strategies that pertain to you and you want to save them. And then you can now go through and look through if you want to email or download them to yourself and save those strategies, or email them to a colleague and say, hey, check out this strategy. We've created an easy way to do that. Because our site doesn't create a login for you, we encourage you to do this regularly or when you visit the site and go through, because it will save for some amount of time, but it won't save indefinitely. So we don't want you to lose 20 strategies that you wanted to save and export. Just try to do it regularly. But again, this is a good way to save and compare strategies as you're going through, rather than having to favorite 20 or 40 strategies in What Works for Health. The last part of the website that I want to highlight that is coming new March 18th are 4 new action learning guides. And if you haven't been on our action learning guides page, I highly suggest you check it out. They're resources that provide opportunities to dig deeper into specific topics. And they have a blend of guidance tools and hands-on practice, as well as reflection activities. You can do them by yourself or with a team. And it's really about understanding a topic and digging deeper in it and gaining those skills. We have 4 new ones that are coming out for release. The first one, develop strategies to promote health and equity. And then 3 related to data, which we're really excited about. And we're particularly excited about these because they discuss what data already exists, both qualitative and quantitative, within your community or nationally, and how do you harvest that data? And then how do you use that data for action in community health improvement? So you can see the 3 topics kind of span that, that continuum, and we're really excited, and we hope that they're really useful for community members. Again, lots of good examples and stories in there to think about from other communities. So with that, I'll hand it back to Allie and see if there are any more questions coming in, if we have time for one question. Otherwise, we can keep going and save time for questions at the end of the webinar.
Yeah, thanks, Annie. I think we're actually doing pretty good on time. Raquel, any questions you want to lift up?
Yeah, so one is, how can we use the rankings data and tools to look at racial equity in our county?
Thanks, Raquel. That's a really good question, and one we're also working on is how do we provide the tools to help counties do that. And I think some of the tools that I lifted up today, or some of the data points, would be useful to think about. Again, the race data that we have on the snapshot, the new apps that we have, or the new app that's coming, I think is a really useful way to talk about it in community. And then I think some of our other resources, like things on what works for health that talk about how strategies can impact disparity, as well as some of our tools in terms of the action learning guides that really talk about inequity and disparity within communities and how to work towards addressing those can be really helpful. So happy to continue that conversation. That's what I'd say. But I think there's a lot of tools to get started.
Great, thank you.
I think, Raquel, we have time for maybe one more.
Okay, super. How can we find more granular data?
So we are county health rankings and roadmaps. So we obviously publish data at the county level, but we do always have, I guess there's two places I would point people to. One is on each measure write-up where we talk about the measure data source and the definition of the measure. We have a section there where we talk about if the data is available at a granular level, either geographically, by race, by age, by gender, or social and economic status. So that's one place to always look, as well as we compile some data in your state in the Find More Data section where some of that granular data might be available, or we compile data sources, I should say. And then the other thing I would point to, and I'm calling on Courtney again, thanks Courtney, if you have a second and can chat out the link to some of our grantees did some work on this a couple of years ago, thinking about how to get more granular data and how to get it, and then the lessons learned with obtaining that data. So we have some resources on our website with some lessons learned from them that I would point people to as well. And then we also have some community partners, I think, that we would point people to as well. City Health Dashboard is a really great resource if your city is in that, as well as 500 cities and other data sources that have data at the census tract level, et cetera. Those can also be found on our Find More Data page, and we list some of those national data sources and partners.
Great, thanks, Annie. I think we'll continue on with our next couple of slides, but certainly have one more place for questions. So keep lifting up your questions as they're bubbling up, folks. It's really great to see both what's resonating and where you have some questions emerging. I'm going to take a second and share my slides now. And so now we want to spend just a couple of minutes talking about the ways in which you might consider leveraging the rankings and other resources for action. We want to give some tips and strategies for making the most of the rankings release. So I want to start with a recap of some of the resources that you might consider leveraging, and Annie just walked through several of these, right? So we started with the County Health Rankings model of health and how to think about health broadly. You might consider how you'll use your rankings and your new county snapshot and the county level data. And you might also consider thinking about how you could use the state reports. So before we get started, we want to hear from you using, if you think back to that Zoom or to that introductory video we shared with the raise your hand feature, we want to invite you to raise your hand if you have had a story in your local paper or on the radio about the rankings. I see lots of hands going up. That's awesome. And as those hands are coming in, I'm going to take us to our next slide. And so the ranks are great for garnering attention. And we've heard from communities that they use the rankings to generate attention, to tell their story through the media. They take advantage of any media attention by talking about current efforts to improve health. They also use the rankings to connect directly with other community leaders and partners they want to engage. The rankings release is an opportunity to invite others to join you. It's also an opportunity to start or deepen the conversation about health and equity in your community. So I'm going to walk through 4 simple steps to help you prepare to leverage this year's rankings release as a call to action. So one of the key messages of County Health Rankings and Roadmaps is that everyone has a role to play in improving health and advancing equity. The rankings release is an opportunity to connect or reconnect with stakeholders in your community. So a great starting place is to think about who needs to hear your message. And so when you're thinking about this, you can think about a few different groups of people. And so let's explore who those groups might be. The first that comes to mind is partners, people involved in your work. It might include a leadership team, partnership members, volunteers, and funders. The next group to consider are potential partners, the people that you might like to engage in your work now or in the future. And so the image on the right-hand side of your screen shows some potential partners you might consider reaching out to, and thinking about what relationships exist and how you might build new relationships if there isn't a current relationship in place. The next group you might consider as you're thinking about who needs to hear your message are decision makers, the people who make decisions in your community. Perhaps it's elected officials or organizational leaders. And finally, consider influencers, those who can influence decision makers. This might include community members, people who read your local newspaper, or voters. So just take a second now and maybe reflect, as you're preparing for this year's rankings release, which audiences might you want to reach? And again, we'd encourage you to use the chat function to share your reflections. So step 2, once you know who you're trying to reach, think about your why. What is your purpose and what is your call to action? And so there could be a couple of things. Do you want to share knowledge? Provide some basic knowledge on an issue before taking action. You can share your knowledge when you tell your story through the media. Many communities take advantage of any media attention by talking about current efforts to improve the health of their community. So maybe you want to encourage action. You might use the rankings to make a case to a community leader or partner that you want to engage about the why they have a role to play in creating a healthy community. It's an opportunity to invite others to join you in your purpose and action. Perhaps you want to celebrate. This includes celebrating victories with the people who helped you make change happen. It's an opportunity for your supporters to see themselves as part of the action, and this might make them more likely to support you again. So think about what good things are happening in your community. Use the rankings release as an opportunity to talk about the importance and value of existing efforts and partnerships. So step 3, remember I said there were 4 steps, so we're halfway. Once you know who you want to reach and why, think about what you will say. How will you motivate your audience to listen, to care, and most importantly, to act? So as you develop your message, remember, you control the story. So think about what story you want to tell. Focus on action and assets. What are you already doing? What are the strengths of your community? What are the opportunities to build upon those strengths? Get specific and include a call to action. How can people join you? What's the opportunity to get involved? One of the things that we hear, or that we frequently have heard, is that you might be concerned that your county doesn't rank rank well. And that's understandable. And so we wanted to just share a couple of examples of how a low-ranked county has used the rankings release as an opportunity to highlight good work. And the rankings release is also an opportunity seen as a rallying point. And so 2 of our RWJF Culture of Health Prize winners are also low-ranked counties. And so in the Bronx in New York and Menominee County in Wisconsin, it's about as difficult as you can get. Menominee is a small rural county that shares its borders with the Menominee Indian Reservation. The Bronx is urban and huge, and both counties have used their low ranks as a rallying point. And so we hear that reporters might ask why your county is ranked at or near the bottom. And what we offer is that it's okay to acknowledge that some of the challenges that your community faces. It gives you the opportunity to talk about conditions that create barriers to health in your community rather than simply focusing on one specific health issue. This also opens the door to highlight solutions. What changes are you and your partners working on to create and address those barriers? So another important piece to lift up as you're thinking about your messaging is to call attention to the differences that exist within your county. This is important for all counties, but can be a particularly useful strategy for higher ranking counties. You might think it's easy if you're at the top, but that actually comes with its own set of challenges. There might not feel like there's a sense of urgency, or you might feel that it's harder to find a compelling story to tell. But when you look a little deeper, you may find differences in opportunity and outcomes within your county. This is part of your county's story too, and many people move past complacency to action. And so you might recall Annie mentioned earlier that we're excited this year to continue to expand the ways in which we provide data for measures that are broken down by race. And one of those measures is children in poverty. And so I'm lifting up, this image comes to us from Dane County, Wisconsin, where the University of Wisconsin at Madison is located. And when we look at this image, we can see that the overall rate of children in poverty is 8%. And when we look at the numbers by race and ethnicity, it's quite alarming. You can see that the percentage of Black and Hispanic children living in poverty is up to more than 7 times that of white children living in poverty. Closing this gap is something that many people in the community are focused on right now. And so just again, want to acknowledge that the state reports will have a focus on equity and gaps by race and place, and Annie walked through many of the new features. While the state reports will focus on gaps at the state level, you can use those reports as a starting point to bring an equity focus to the conversations you are having at a local level. And so some questions that you might consider as you're digging deeper and exploring are, what do the differences look like in your own county by neighborhood? What about by race and ethnicity? Who doesn't have the same opportunity to live their healthiest life? And so again, thinking about how you can use state reports and county level data to bring that focus on equity to the front and center. All right, and as we wrap up thinking about how we can use the rankings release to inspire and drive action, we want to offer the opportunity to deliver your message, to share your message. So a key consideration is, how will you deliver your message? So you can connect with the media by sending out a press release or contacting your local newspaper, TV, or radio station directly. Our communications partners work with folks in each state to help get the message out about the rankings each year, resulting in significant media attention at the national, state, and local level. We encourage you also to do some provocative outreach with local news outlets and draw attention to health and any work that you are doing to improve health in your community. Connecting with the media is a key takeaway to reach and influence decision makers and the broader public. You can also write op-ed letter or a letter to the editor. Consider engaging your partners and telling your story by asking them to write an op-ed or submit a letter to the editor. And of course, social media is also an important way to get your story out to your community. So besides engaging with media and social media, there are also a number of other ways that you might consider delivering your message. You might consider hosting a community meeting to share the data and hear about how the issues look and feel in the community. Some of the conversations that this might invoke are what challenges is the community facing with food insecurity, and how is this impacting people? What's happening with jobs and housing? What's important to them? What do they care about? And what ideas do they have to make things better? The data is really a starting point, but the community can add important context. You might consider making a presentation to deliver your message, and you might think about who are those groups that are important to connect with. Perhaps it's a local board of health, a county board, or a community group. And we've heard feedback that at the state level, groups have held meetings with legislatures, sometimes a legislative breakfast or event, and sometimes they've just gone and done individual visits to specific legislatures. In fact, earlier somebody chatted in that this was a strategy that they used to share the state reports and county level data for the areas they represent. And finally, one-on-one conversations can be a powerful way to connect with a potential partner, a community member, or a decision maker. So as you prepare for the 2020 rankings release, we encourage you to take a little bit of time to consider who needs to hear your message, why, what are you going to say, and how are you going to deliver your message. And before I wrap up, Raquel, just wondering if through the chat, if people have shared who they're interested in connecting with or how they might use the rankings to garner media attention.
Yes, people had some great, lots of chat going on. Just want to remind folks to always do all panelists and attendees so you all can see all the stuff I'm seeing. Some folks said, or one fella said, in terms of stakeholders, nurses to address the nursing workforce shortage and other specific nursing needs within communities. Let's see, gosh, there's been a lot. A lot of different questions and thinking around how folks can prepare for media in their community. And I talked about how we've got a great feature on our homepage on our website where you can ask a question and it'll get triaged to someone probably in your region with the answer to that. So yeah, lots of stuff.
Great. Well, thanks, Raquel. And just again, offering up this image to speak to the power of connecting and partnership. And so as you think about how you might use the rankings to spur action, think about who you might connect with in community. I think we're at our final Q&A slot for the afternoon. And I know that questions are coming in, so Raquel, I might turn to you to see if there's a question or two to lift up. I know that Courtney has also been managing Q&A from her space. So Courtney, would also invite you if there's anything that you would like to bring into the room. We have just probably time for one question. Okay, well, I'm not hearing any, and as a reminder, we will also have the extended Q&A immediately following. But before we do that, and before we share the link for that, we hope that you've learned something from the information that was shared today. And we want to know how we did and what was useful for you. So we've got a brief survey that Raquel is sharing. She's dropping that in the chat. And then next to come will be a link for the extended Q&A. Join us if you have more questions about data, or if you want to continue the conversation about how you might use the rankings to engage your community or working with the media. Myself, Annie, Erica from our team, whose voice you haven't heard, but she's been with us today, will be there. So we look forward to having you join us for that extended conversation. Finally, we wanted to share some upcoming opportunities. If you are new to us, you've heard a lot of information today, and hopefully you're hungry to hear more. We just opened the registration for our upcoming CHR&R 101. And we hope that you'll join us to learn how you can use data to reveal the factors that influence health. Think about use evidence to focus on the strategies that work, and guidance to put strategies into action. And along the way, we'll share stories of real-world experiences to inspire and inform your efforts. And so Raquel's chatting out the registration link. Like I said, just posted today. And finally, we have an upcoming cohort learning opportunity that we wanted to lift up again. And we'll be convening a cohort in the Delta region that will focus on building resident engagement. So if you live or if you know someone who lives in Mississippi, Arkansas, Louisiana, or Alabama, please share the link to the application that Raquel is placing in the chat. And we're excited to begin that work here soon with this upcoming cohort. And as always, stay connected with us. Lots of opportunities through social media. We have a newsletter that goes out regularly. So if you're not a part of that list, feel free to subscribe. We'd love to see you join us in those spaces as well, social media and via our newsletter.